Hello, everyone. My name is Lindsay Mayo, and I'm going to share my screen and begin the presentation for my practicum project for the RN to BSN program. All right. So my project was titled The Implementation of a Perioperative Handoff Tool. And again, my name is Lindsay Mayo. I'm a registered nurse currently enrolled in ECPI's Bachelor of Science in Nursing program. So the objective of this presentation is to discuss the project findings for the handoff tool that I created, implemented, and then evaluated in a plastic surgery clinic setting. Handoff can be defined as the communication that takes place between two nurses when a patient's care is being transferred from one nurse to another nurse. This project focused on implementing a handoff tool to increase communication and increase patient safety and identify anything that might cause the patient harm or cause an adverse outcome for their care in the perioperative setting. So how did I achieve the goal of this project? First, I needed to analyze some peer review articles regarding perioperative handoff process. I reviewed 10 articles and documented my findings in an annotated bibliography. I also conducted staff interviews with the nursing staff and performed observations on the current workflow process for perioperative handoff. I also obtained written permission from the appropriate leadership before beginning this project, and I obtained consent from each of the nurses who participated to use their name and credentials in some of my documentation. The second objective was to implement that handoff tool with the new workflow. So Hagen et al. Tells us that a perioperative checklist system is only as effective as the healthcare team members who are implementing it. So it was extremely important that I prepared this group of nurses to effectively implement this tool during the trial period. Shortfalls with communication can cause patient harm, especially during the time of perioperative handoff from the OR to the PACU unit. So I conducted a 30-minute in-person training with the 3 other nurses on staff, the practice manager, and my mentor. That training was guided by a lesson plan, and then the staff who participated also took part in a post-training quiz to help demonstrate their understanding of the topics discussed. Once the implementation began, I did keep a record of use to document each time that the tool was used, and also to document the nurses who performed handoff, who received handoff, and any circumstances that were unique surrounding why that handoff took place, as well as any new information regarding the patient's health history or current condition that were identified through that handoff. So objective 3 was to evaluate the effectiveness of that handoff tool. The initial plan was to implement the tool over a 3-week period in the clinic setting. However, due to some scheduling limitations and time constraints, 2 weeks posed to be effective to implement the tool and also gather enough evidence to reach the outcome of this project. On the right side of your screen, you will see a copy of the actual handoff tool that I created and implemented through this project. This was printed on a half sheet of paper that was easily accessible to the nurses so that the nurse who was bringing the patient back to the procedure room and checking them in could use this as a checkbox system or take notes as they prepared the patient for their procedure. This same sheet of paper was also used by that first nurse to give handoff to the second nurse who would be assuming that patient's care. This form was also flexible enough that a blank copy could be utilized by the nurse who was receiving report to also take their own independent notes on that patient. And it also prompted them to ask any questions at the end of the handoff session. So after using this handoff tool, it was evident that the quality of information shared during handoff was improved when compared to the information exchanged pre-tool intervention. Also, the staff reported that they found the tool easy to use. It increased their confidence when giving report and overall satisfaction with knowing that this tool could be implemented in the setting for the long term. So let's talk about how I documented and produced evidence of my learning and of my project. So first, I needed to review the current policy and workflow to be sure that the handoff tool and how we were implementing it remained in compliance with the current policy as well as with HIPAA. I also, again, reviewed those 10 articles that provided a lot of evidence-based research on why handoff tools were effective and on the different types of handoff tools. A lesson plan was created to guide the 30-minute in-person training session. And then the post-training quiz was distributed and taken by the participants. I also needed to document and introduce the new workflow and how that would look, as well as the tool itself, and talk about how to implement that into that new workflow. Again, once the tool was implemented, I kept a record of use that talked about when the tool was used and what type of procedure the handoff was occurring for. Once the implementation phase concluded, I was able to perform some post-implementation interviews with the staff and collect their feedback about what they liked about the tool, what they disliked about the tool, and any general comments or feedback that they had. Steinquist et al. Tells us that while it's important to encourage change and promote that continuity in the workflow culture, it's also important to preserve as much of the current practice as possible so that staff feel like it's easy to move into the change and not like their world is being flipped upside down, essentially. Also, understanding staff's perception regarding handoff was important, and I was able to identify how the staff felt about handoff before and after implementation of the tool by conducting some of those interviews with my peers. Okay, so the outcome for this unit was reached by this project in the way that using a handoff tool promoted increased communication and identified potential safety risks for the patients. And this was completed more efficiently after the use of the tool than it was prior to the use of the tool. It's vital for patient safety that nurses feel empowered to advocate for their patients, especially in these times of handoff where information can be omitted or missed, and that can potentially cause unnecessary testing or unnecessary interventions later on in the patient's care. Using a standardized process for handoff has been proven effective in previous research, and it again has been proven effective through my own research during this project. So this tool continues to contribute to my practice and education, and that the day-to-day use of this tool continues to enhance communication for each new patient who comes into our care and who may have surgery with our providers. It also helps us to continue to apply those, grounding evidence-based practices into our clinic. Postoperative handoff, as we mentioned, is a really high-risk transfer where a patient's coming directly from the OR to the PACU or from the PACU to the ICU. And so these times are especially crucial that nurses take responsibility for giving excellent handoff to the next nurse who's assuming care. This project has really enriched my knowledge and experience in the areas of research and quality improvement. And although I've taken classes on these topics before, this project really helped me to understand research and how to assess and evaluate the information that I read in the research articles and how to implement them into a quality improvement project. In the future, I would certainly recommend that similar practice settings implement a tool like this one or another type of handoff checklist tool, such as the IS bar or the iPass tools to facilitate excellent handoff. So the value of this project has really contributed to my lifelong learning, whether or not that takes place in a structured classroom environment or just in the clinical setting in my practice. I was able to kind of revisit and fine tune a lot of skills that I have acquired over the course of my education and practice them through this project. And these skills included leadership, problem solving, education of my peers, as well as patient education, research, reflective writing, data collection and evaluation of that data, and also quality improvement skills. This experience has really motivated me and given me a big confidence boost so that in the future I'll be more willing and apt to participate in research and other quality improvement projects, either as a staff nurse or as a nurse leader. And this experience will definitely serve me and serve my patients in my practice day to day and in my continuing education, as I mentioned, whether that be inside a classroom or not. Here's a list of the references that I used to complete this project, as well as complete this PowerPoint for you. And I'm going to stop sharing my screen now. And I just really want to extend thanks to those who have watched this video. And I hope that you find this information helpful to you in your practice, but also a little bit of an inspiration for you to continue to learn every day and grow for your own self, but also to pass that on through your care to your patients. Thank you so much.